Hi, my name is Erin Giovanetti. I'm a senior research scientist at the National Committee for Quality Assurance, and I'd like to talk to you today about some of the exciting new work that we're doing to develop a new type of quality measure. We call these person-driven outcomes. Our goal is to develop quality measures that really get at how well health care organizations are helping people to achieve what matters most to them. And this is really important for complex populations. Older adults with disabilities or multiple chronic conditions, people that face complex trade-offs in their healthcare decisions. So to inform this work, we started by doing focus groups with over 100 older adults with disabilities. And we asked them, what are your goals? What matters most to you? And what we found is that people have a really diverse set of things they want to get out of their healthcare. They talk about health and quality of life goals like managing symptoms or increasing their mobility. But they also talk about values, things that are important to them, like being able to play with their grandchildren or not being a burden to your family. They talk about goals they may have for the people that help them, their caregivers. So they may say, I want to be able to help my caregiver be less stressed. And then they talk about things they want from their health care. I want to stay out of the hospital. I want to get my doctors to talk to each other. So as we think about how do we measure outcomes for this population, what this is telling us is that we really need an individualized approach. So what we've developed is an approach called person-driven outcomes. These are outcomes that are individualized, and they're identified by the patient or their caregiver in some cases as the thing that matters most to them and is most important for care planning. To start the process of identifying person-driven outcomes, we need to help people to have discussions with their care providers about what matters most to them. And to inform this discussion, we developed a goal inventory. So it starts by looking at a bunch of different goals that different people have expressed, and this comes from our focus group work. And this is really just meant to be a conversation starter. And you can pick from one of the list of goals here, or you can enter your own goal. So for this individual, we're just going to take a sample case here, they decided that what their goal that was most important to them was to reduce their anxiety when leaving the house. This was an individual who had a lot of history of falls, and so she became very anxious whenever she left the house that she was going to have a fall and become injured. So anxiety was one of the main issues she was working on. We asked them to rate how important this goal was, and then most importantly, how are they going to measure whether or not this goal is being achieved? We offer two different options in our program. So one option is that you could use an existing standardized patient-reported outcome measure, or PROM. Another option is that you would develop your own outcome. So let's say this person picked option one. They decided anxiety. We have built into our program a list of standardized person-reported outcome measures. These are actually all drawn from the PROMIS database, which is a list of different standardized surveys that are all validated and reliable for measuring different symptoms over time. And for this individual, they could pick anxiety. But another individual who has a different goal could pick a different outcome in this list. So let's say that none of the outcomes in that list really fit right. What this person really wanted to do was to avoid accidents such as falls. We don't have a standardized PROM for falls. So for this person, what they decided to do was to actually build their own outcome. So here they can lay an outcome such as avoid accidents such as falls. This is something where they would like to improve versus maintain, although this works just as fine if somebody wants a goal that is to stay in a current state. And they lay out what it would look like to achieve this goal. So where they are right now is that they have one fall scare in the next 2 weeks. That's what they expect. But where they'd really like to go to is to have no fall scares in the next 2 weeks. And what would be even better than that would be to complete their physical exercises in 5 to 7 days, as well as no falls. And then even the best possible would be that they're actually doing their physical exercise therapy every day. So we actually piloted this approach. What we did was we went out to 8 different organizations and we asked them to pilot this with a small sample of patients, about 20 to 50 patients per organization. And what we got back was fascinating. The range of goals that people express when you ask them about what matters most to them is really diverse and really points to this need for an individualized measurement approach. So we saw some people talked about goals to eat without worry, this is a caregiver goal here, to identify a home provider or agency who can stay at home with patient when caregiver needs to attend their own medical appointments over the next 2 months. I want to get out of the house for more things other than medical appointments. That was a common goal that we heard. And really what we're seeing is that the goals that people express are both unique, then they also often don't fit within some of our standardized measurement tools that we have now. So what happened when we did this pilot? So we ended up with a total of 8 organizations and 232 patients in our pilot. And what we found was that when we implemented these 2 methods, so the goal attainment scaling, which is where they can create their own goal, and the PROM, which is where they're picking from a list of standardized tools, the majority of patients and care managers chose the goal attainment scaling. 184 out of the 232 chose goal attainment scaling versus the PROM. And when we looked at the follow-up, we actually saw that follow-up rates were far better for people that were in the goal attainment scaling versus the PROM. And then what happens when they actually came to meeting the goals? Well, we found that about 74% of people who set a goal with goal attainment scaling and had follow-up met their goal. 70% of people with a PROM met their goal, for an overall rate of 73% of people setting a goal and meeting the goal. But what was really most interesting about this whole thing is that the reaction we got from both patients and care managers. So here you can see a quote from a 69-year-old female patient. You know, you can tell somebody what to do, but I think you convey better things when you give people options to do. Find out what they like. We really heard strongly from patients in this program that what they found most valuable about it was that this was based off of what they expressed as being most important. We also heard from the providers that were engaged in this. So a nurse care manager said, all of a sudden they were totally engaged in their healthcare, and that was new for a lot of them. So I thought this was really cool. They found that by talking to people about these goals and using this process to actually measure progress on the goals, people were remembering their goals. They were following up on them. They were printing this information out and putting it on their refrigerator to track. And we found that this also empowered individuals that were engaged in this. So here we have a 64-year-old male, and he said, I found that in doing some of the things we put down here, there's a strength in me. So our next steps on this, we think this is a promising approach to quality measurement and to improving care practice, and we'd like to move into a larger scale demonstration where we actually see how this would work when it's across a whole organization. This work has been supported through grants from the SCAN Foundation and the John A. Hartford Foundation. Thank you very much for your time today.